Good afternoon, everyone. We're here for another Ovadia Heart Health live stream. Um, we're expecting Dr. Ovadia to join us shortly. I think he's finishing up a consult. So I think we'll get our medical disclaimer out of the way, and then we'll uh, proceed with our conversation. Anything that is discussed on this call um, is for informational purposes only and not a substitute for professional advice or treatment by a licensed healthcare professional. Um, you're advised to seek the care of a qualified doctor or medical professional when undertaking any changes to nutrition, diet, or fitness, including any that we may recommend. If you'd like to learn more about how you can work with Ovadia Heart Health, you can email us at team@ifixhearts.com. And if you're looking to improve your metabolic health of your workplace, go to ovadiahearthealth.com/wellness. Okay, got that out of the way. The topic of our conversation today is, at least in a large part, will be the Symposium for Metabolic Health, the 9th annual BOCA Symposium that both or all of us, Krisna, Lisa, myself, and Dr. Ovadia were at this past week in Boca Raton. And then Dr. Ovadia had delivered a really compelling presentation on how to stay off his operating table. And he talked a lot about the things he's learned as he's been building this Ovadia Heart Health practice. Krisna, I know you were, and Krisna is our Director of Employee Wellness. I know you were taking in the live stream of the conference, and I know you were a very active participant. What was your takeaway from the symposium this year?
Oh, great question, Chris. And nice to see you, Lisa. Nice to see you, Chris, as well. And I chatted with Lisa pretty regularly throughout the conference, even though she was there live and I was there virtually. There were so many takeaways this year. And as I was saying before we came on the air, sometimes doing a conference virtually is a little bit refreshing because you can really focus in. You can be serious about your note taking. You're not just doing the interperson thing, which is a lot of fun. But I'm going to start off with a couple gems I took away. I thought, and I have so many notes. Oh my goodness, I'm going to have to clean them up one of these days. Dr. Gupri Pada, who, amongst many things, is one of the leaders in the Society for Metabolic Health Practitioners, made some very, I thought, insightful comments about the relationship of metabolic health and chronic pain. Two quotes I wrote down. One was, if you have chronic pain, you're not metabolically healthy. And the other was, you can't get chronic pain unless you're already inflamed. And I know Lisa talks a lot about inflammation with our patients and how to guide them, but I thought that was a kind of interesting start to the whole conference of really making this relationship between pain, inflammation, and metabolic health.
Yeah, I agree. So, I mean, that's the one thing that people don't understand. Like anytime you get a diagnosis of an itis, the itis stands for inflammation, right? So if you have arthritis, which I hear from a lot of patients, especially when they, I say, are you exercising regularly? Oh, well, I have arthritis. And, they tell me, of course, their joints hurt, right? So, and so we know that the underlying cause to a lot of things is, inflammation. And we talk about that pretty regularly within the practice and when I'm seeing patients, because again, we know what, insulin resistance and inflammation. So, and we definitely look at that as an underlying cause to a lot of other illnesses.
So agree. And one of the other pieces from Dr. Pata that he was very, and of course, this is my wheelhouse, but promotion of highlighting the importance of coaching. In saying that he can only make a difference with these patients if they incorporate lifestyle coaching. And that's one of the best things about our team. They get the advice and the work with Lisa over lab, over consults, over everything. And then they work with us coaches. And then, of course, they get to see Dr. Ovadia, who just graciously pops in right as I'm queuing. He set me up for that. So I just made the intro work perfectly. We're discussing some of my highlights that I took away from Dr. Gupre Pada, and that relationship between chronic pain, inflammation, and metabolic health, that I thought was a great way to kick off the conference.
Yeah, perfect. Thanks for that, and great to be able to join everyone. Yeah, we just wanted to kind of share our perspectives coming away from the Low Carb USA conference. I thought it was another, great event put on by the Society of Metabolic Health Practitioners. What was most, impressive for me, and was best. The best thing, my takeaway from it was how many physicians were there. There were a lot more, not only physicians, but practitioners of all sorts, but a lot more specialties represented, which I thought was great. I even ran into another cardiologist, another crazy cardiologist who thinks low carb might be good for your heart. And so that was very good to see. And that was one of the things that I was most excited about coming away from that conference. Lisa, what was your top takeaway, would you say?
I think what I really enjoyed was the Women's Health Day. I really think that it's an area that is very overlooked for women. And I think even going into the fact that we do cardiovascular health going into the month of February, which is Heart Health Month, understanding it was very interesting, the statistics on how women are not looked at in the same way as men when it comes to heart disease and actually having heart attacks in general. They are kind of pushed off a little bit because we don't present in the same way. So I think that was a really big takeaway for me. It kind of gets behind me just being a woman and being, a little bit older, understanding that, you don't necessarily present the same, so that, the acid reflux that you think that you have, or the jaw pain that you have, some things, if it's not going away, those are some things that you really need to check into and, kind of really push the fact that, I really want this checked out because it could be something. Men get treated within, 24 hours, and women, I think the average, I believe, was over 57 hours before treatment. So, it was really eye-opening to me, but, urging women that, don't just take it for nothing. It could be something.
That highlighted, Lisa, for me, I was just thinking too, not only just on that was certainly a highlight, that first day with the focus. And I hope they do more of these sort of with that angle of Dr. Rob Seiss comment of that every person has to manage their health and to be proactive. He highlighted the difference between, consent versus compliance. And again, especially for the females who, maybe aren't sort of noticing the symptoms, are afraid to vocalize it. Oh, it'll go away. Let's just wait a few days. But that whole idea of really being proactive and managing your own health.
Excellent. Yeah, I thought that was a great message that came through many different ways during the conference. And in a lot of ways, it is a message of the low carb community, right? This is about taking charge of your health, not sitting back and expecting others to do it for you or someone to provide good health to you. I think a large message within our community is exactly that you need to be in charge of your health and you need to be leading the efforts around your health. I wanted to hear from Chris. So Chris, you've been attending these conferences for quite a while now. The first place we met was at this conference, 5 years ago. And I believe you had been to them even before that. That was the first time I had been to it 5 years ago. You've been playing a role in the community. You help with the social media for these conferences. You help with some of the other, promotion and media of it. But this was your first time attending, now as a certified health coach. So maybe talk a little bit, from your perspective. First of all, what was your big takeaway from the conference this year? But also maybe what was a little bit different attending it as a practitioner now versus, in the past when you were just someone who had personal interest in this?
Oh yeah, it's a great question. First of all, I love the in-person aspects of these conferences. Yes, 2020 was actually my first conference too. So when I met you in the elevator on the way to probably the presentation hall, that was my first conference, and these in-person meetings are a great way to start conversations that in some cases like that one has lasted a long time and developed into something very positive for me and what I'm doing. 2 years ago in San Diego, I got to meet Krisna in person for the first time. We got to exchange our information that we both of us and also you, Dr. Ovadia, all found our way to low carb through the same author, Gary Taubes. We got to meet, Krisna and I both got to meet Gary at the conference in San Diego, and then this year in Boca, I got to meet Lisa, which was really nice after all those, Zoom calls. And so that's a big part of it. Being a health coach, being part of the process of officially having a role in helping people improve their metabolic health and their overall wellness, it does change things because my dialogues with other people at the conference took on a new level of importance. I was sharing, what it's like to be a health coach with other people that have, in many cases, years of experience, and I'm asking for tips and pointers and advice. So, it was great, and I also had the opportunity to interview about 20 people at the conference who had all had personal transformations from adopting lifestyle changes and improving their metabolic health, and sometimes just really incredible things, which are not as uncommon as we're led to believe when we look out into the society that we're surrounded by.
Excellent hearing that perspective. And it was so. I kind of made a similar transformation, right? When I was there 5 years ago, it was really as yes, I was a practitioner, I was a heart surgeon at the time, but I wasn't putting metabolic health into practice for my patients, right? I had come across it personally. And like you said, my journey had started, a couple of years prior to that with Gary Taubes and reading his books and then going on a low carb diet and having the personal successes that I had around my health. And that meeting 5 years ago was really when I first started thinking about how can I now bring this to my patients. And this is still something that I think is a struggle for practitioners within the low carb community. There are still a lot of practitioners out there that have, gotten personal gains from this, improved their health, recognize the benefits of it, but they're still struggling with how do we put it into practice. And that kind of ended up being the theme of my talk, reflecting on my experiences doing this, building now this amazing team that I have and having the practice that we've built, which I'm quite proud of. That's what I'm hoping, what I hope to give back to the community with my talk. And, another reason that I gave that talk this year is, and this is kind of something else I want to talk about in our last few minutes, is the bigger movement around health that's going on. And, as we're recording this earlier today, RFK was undergoing his confirmation hearing. I've been seeing some highlights of it on social media. I didn't have time to watch earlier today. But just wanted to kind of get each of your thoughts about the larger movement that's going on around health today, and the discussions that we're seeing. So Krisna, maybe we'll start with you.
Yeah. One of the benefits of being older is you have strong opinions about, and you're less shy about vocalizing them anymore. So that was my disclaimer. I would say, and actually, this is something you said, Philip, in your wonderful wrap up at the conference. We need to change the paradigm, and something that was very evident. Between clients, between work, I caught some clips also of the hearing. As the status quo is going to put up a hard fight, and we have a lot of challenges on this road. I've been in this space since, we've all just said, since Gary Taub, since 2007, 2005, maybe. It's a long time. But I think the pressure valve is stronger. And what was refreshing at the conference, there's more and more people feeling brave about vocalizing the sentiment. But, we're up against the pharmaceutical companies, the insurance companies, the fact that people don't maybe have been following the advice, sadly, and it's not working for them, but maybe not willing to recognize that they need to change. So we've got a lot of battles. RFK's feet were in the fire today. I think those of us in this industry need to keep vocalizing about giving people a chance to be healthy. That shouldn't be political, in my opinion, but it is. And we have to find ways to just get the message out that health, metabolic health, is really what's at stake.
Yeah, very well said. Lisa, what thoughts do you have on this?
To me, it's just changing, getting people to educate them. And it's just one person at a time, right? It kind of is a snowball effect. Once somebody sees the difference and they start to realize, oh, I'm so much better now, they start to tell their friends about it, and so forth and so on. And so the more that we get the message out there, and really get the real message out there on what metabolic health really is and how you can make yours better, you always start with you first, right? And then once they're feeling better and they're starting to realize that, they can actually adopt this, that it's actually doable. I think it really does help when we pass it on to, family members and other friends, and hopefully it starts with one person at a time.
Definitely so. And Chris, I'd love to hear your thoughts as well.
I think that improvements to the mainstream system have to be made, to our food supply, to our food environment, to the advice that people are given or even are allowed to consider. We know from all these special days at the conference for type 1 diabetes and cancer and women's health that low carbohydrate, therapeutic carbohydrate reduction as a therapy, cancer, and I just had a little bit of sound problem. So we know that it's possible to make these changes. We have to encourage people to individually take on the steps that they need to improve their health and their fitness and their quality of life. When I see 20 people in a row that have made these transformations just by making lifestyle changes, it makes me know that there's a lot of people that are leaving gains on the table. They're not getting to live life the way that they were meant to live life. So that's how I feel about it.
Yeah, and that's exactly right. That's what this is all about, is really empowering people to live life the way it's supposed to be lived. As Krisna said, health shouldn't be political, but it is good to see it being talked about in those arenas, because that means that society is opening their eyes to the massive health crisis that we're all facing, and that we need to take head on, and we can't just keep doing the same things that have been failing over and over again when it comes to the health of our nation. So great discussion, everyone. For everyone out there, if you're interested in working with our team, please come take a look. Go to ifixhearts.com/talk. Also over at ifixhearts.com on the front page, you can take a free quiz, get your metabolic health assessed, and you can read some more about all the ways that we work with individuals. We also have employee wellness programs to work with companies. And if any of that might be of interest to you, you can reach out to the team, or you can also go to the link there on the screen, ovadiahearthealth.com/wellness. So thank you, everyone. Thank you for tuning in. And as always, we hope you're finding these live streams informative. We've been trying to do them a couple of times a week here with various members of the team, and we look forward to seeing you next time.
Thank you.
Take care, everyone.